As part of activities to improve universal sexual and reproductive health rights in Nigeria, the Federal Ministry of Health, in collaboration with Voicetv, has held an inaugural meeting of the Women Integrated Service for Health Project Extension in Abuja, Nigeria capital city. Country Director Voicetv International Nigeria, Emmanuel Aja, in his welcome address said the project is targeted toward 3 million couple years of protection, 670,000 additional users, advert over 1 million unsafe abortion, among others.
The project strengthens individual knowledge and choice and builds community support for sexual and reproductive health services. It improved access to and expanded choice of voluntary family planning and other sexual and reproductive health services. The project also promoted a supportive legal, financial and policy framework and increased women's choice and access to sexual and reproductive health and rights services through evidence-based innovations and best practices. The WISH project used a combination of direct service provision, strengthening of the public sector health support and services, addressing demand-side barriers to accessing services, and improving policies, financing, and commodity security to create an enabling environment for sexual and reproductive health services over 3 years, which spanned from August 2018 up to July 2021.
Director of Family Health Department in the Federal Ministry of Health, Dr. Salma Ibrahim, said lack of family planning is one of the great contributors to the security challenges bedeviling the country.
It's a great contributor to the insecurity situation in the country because, first of all, the use of family planning is to space the number of kids that you want, the right time you want to have them, and then you have a family size that you can take care of in terms of nutrition, in terms of upbringing, moral upbringing, in terms of education, and quality care in general, so that we have children that are raised as productive adults, adolescents first, as adolescents that are well mentored, well groomed to contribute to national development. So if you see this, all this cannot happen without funding, right from the family level. If you have so much, you may not be able to cater for them. You cannot give them the best education that you desire to give them. So this is why family planning comes in, to regulate fertility. And when you regulate fertility, you have these children that becomes adults that will contribute to our national development because they are well guided. So if we are not able to do this, then we end up in catastrophe. Because you have children that are not educated, that do not have access to quality education. And what I mean education, not just Western education, but even our spiritual education. They are not having access to it. And they think irrational because they become adolescents without work. They are unemployed and they have to cater for themselves. So they resort to all means that is available to them to start thinking of how do I survive. So it's an issue of survival. And this can lead to escalation of insecurity that we are witnessing in Nigeria.
Chairman Management Committee, Association for the Advancement of Family Planning, Dr. Ejike Oji, on his part, advised individuals plan childbirth so as to reduce population outbursts.
15 years ago, some of us were shouting that our population is growing in leaps and bounds. We needed to do something about it, but nobody listened. Now the hens have come to roost. So it has nothing to do with this government or the previous government. It's something that started almost 30 years ago. And then we were shouting. As far back as 2006, the immigration in Nigeria was so much that when I had a conversation with the International Development Minister in Norway, the question he put to me is, Dr. Oji, how come every single day 13 commercial sex workers come into our country from Nigeria? And at that time, the International Office of Migration said, for every 100 Africans that cross the tempestuous sea of the Mediterranean, 14 are Nigerians. Even when our president came into power, he brought back almost 20,000 Nigerians from Libya. These are Nigerians waiting to cross over. So you can see immigration has been a major thing. First of all is the youthful bulge. 72% of our population is under the age of 30. So you have a lot of young people. Some of them are unemployable, some of them are unemployed. So that's why immigration starts. Just about last 2 or 3 months, it was said that about 700 and something Nigerian doctors that immigrated out of this country within the past year. So the young people are leaving because the aspirations are not being met. And then lastly, when you see nationals killing nationals, it started with the OPC trying to protect the Yoruba clan in the southwest, went to restiveness in the Niger Delta, then kidnapping in the southeast, a religious crisis on the plateau, the north central, and then Boko Haram in the northeast, then banditry in the northwest. Now we have it all over the country. These are population driven. No other person can convince me otherwise. It has nothing to do with ethnicity, religion, or politics. It's just the population drive.
Health Advisor, UK Foreign Commonwealth and Development Office, Dr. Ebere Anyachuku, commented the project.
The WISH extension is here to support federal and state governments to really ensure that Nigeria's women and families are able to access reproductive health services where they need it, when they need it, for the betterment of their health and the health of their families. So I'd encourage those women and families to access this as much as possible.
The WISH project is a 3-year flagship project implemented in 13 states in Nigeria and the Federal Capital Territory. Gilbert Da Amadi, Voicetv, Nigeria.